the discussions, the public discussions, are about the inability to sustain our healthcare system in the form in which it's presently constituted. And that, to me, speaks of the importance of making appropriate investments in prevention. And given that smoking cessation is Canada's most important preventive intervention, it makes sense that we should be focusing our efforts on enhancing our ability to help patients stop smoking. And just a few days ago, Ontario's Minister of Health, in a major speech, talked about Ontario's action plan for healthcare, in which she outlined a whole way of very imaginative and very challenging innovations that she hoped to oversee in the course of the next few years in order that we could address some of the challenges in our healthcare system. And front and center in that document is a smoke-free Ontario. And you're going to hear later in our conference from Dr. Peter Selby, who's going to be talking about ways in which we can develop a truly integrated smoking cessation system provincially, and he will perhaps use Ontario as the example, but this is a harbinger of things to come. So, the underlying premise of what we're about here is that all health professionals in every healthcare setting have a responsibility, in our view, to help patients stop smoking. It is not good enough for the cardiologist or the respirologist or the urologist or the obstetrician to say, I see you're a smoker, speak to your family physician if you've got one about the importance of smoking cessation if you're interested in it. All of us have a responsibility to assist this major personal and public health problem. And one of the things that's been most gratifying about the process of which this conference is a part is the degree to which the number of individuals who've been influenced by programs that we have been developing, not that they are the be-all and the end-all, but they're an example of the kinds of programs which we think are effective. We have now reached almost 62,000 smokers since we began to develop these systematic approaches 5 or 6 years ago. Variants of the Ottawa model are now being expressed in 122 health sites across Canada. And we've moved out beyond the acute care hospital kind of setting. And you're going to hear from Dr. Sophia Papadakis in the course of this conference, who'll be talking about our work in the family health team setting in Ontario. Now involved with almost 40 family health teams across the province. Those health teams reach 500,000 patients, 75,000 of whom are smokers. And the whole approach here is to integrate the principles and the premises of the program so that there is consistency and an interrelationship which is strategic and likely to enhance the success across the health system. It's all about working together to help patients quit. And we're delighted that you're with us here today in order to be part of this process. We look forward to laughing with you, to learning from you, and to enjoying ourselves in this wonderful environment, and to commiserate with you as you show us your bruises and your bumps from your skating experience on the canals. Bob, anything you want to add in closing?
I just wanted to say one more thing. Apparently there's another delegate at the conference whose name is Robert Reid. Is he here? There he is, there. Now this guy apparently is much taller, he's got a lot of hair. So welcome, Robert, to this conference. You've got a great name, but don't confuse us, please. It happens all the time.
And you know, obviously, as we would say, somewhat posh today, because normally he speaks with a kind of a different accent. Right? And Bob, you're not from the Ottawa Valley, are you? No. So Bob, there's a kind of vocal characterization. Could you just...
Can you talk like this, Adele? You can see what's going on at the conference today. It'll be a lot of fun. We'll have some beers after. I got a 2-4 out on the porch and it'll keep it nice and cool.
So laugh a lot, learn a lot. We're delighted that you're with us and look forward to getting